And that should heal up good, and you should get back to all your activities down the road.
Oh, great.
Whatever you want to do.
Uh-huh.
You shouldn't be restricted by that incision. It should heal up like strong as steel. And then there'll be a few drains down here because it's surgery, so a little bleeding's normal, so we want to keep track of that. So there's a couple drainage tubes. Many people, those are more sore than the incision itself, just because they go through some soft tissue, you know.
Uh-huh.
And this thing is it's rigid and immobilized, you know. So anyway, we slide those tubes out a couple days later. There's a catheter in your bladder. We slide that out a couple of days later. That's pretty much it. And so our job is to, after surgery, get all the hardware out of you, get the extra water out of you because you soak up water. Everybody's puffy after surgery. Get you off your oxygen, control your pain, get you eating and moving your bowels, get you walking, and let you go home.
Oh, okay.
So what's that, a couple days that they stay in the hospital?
I tell people 4 to 7 days.
Oh,
we usually don't send people home before the
Yeah.
4th post-operative day, and surgery is day 0.
Okay.
So if you come in on a Monday, you might go home on a Friday.
Yeah,
I mean,
no problem.
Yeah, not an issue. Yeah.
You're like a spry, active guy, so that's very much on your side.
Great, thank you.
But you really have to, it takes a lot of effort on the part of the patient. And you have to cough and you have to walk. Those are the 2 keys to like getting out. As silly as that sounds, it's like if you don't cough and you don't walk, it's going to be a long stay. The coughing gets your lungs nice and big.
Oh.
And when the lungs are big, they clean themselves properly and they work well.
Nice, very nice.
Otherwise, your lungs turn into grapefruits, and they get pneumonia, and you need oxygen and all that stuff. And then the second thing is something magic about walking. Like when we're in bed, man, our bodies just give up and get ready to pass. You know?
Yeah.
When you're upright, it sends your body a signal like, oh, we got to get going here. And so you hang on to your muscle better, and your gut function returns quicker, and you get out. But it's hard to walk after surgery because you're so darn tired. You're exhausted. You're wiped after surgery, so you just got to
make it happen. Sure.
And then when you go home, you're not fragile. We just want you to do the basics. Eat, sleep, walk, and cough, pretty much. And then the only other, take a shower once a day. And when you get out, that's fine. And then call me if you have any problems, like nobody else.
Okay.
So I want to be your primary care person for the
Nice.
first couple weeks. And our office is pretty much set up, so I think we do a pretty good job of making ourselves reachable and fixing problems, because we don't want you back in the hospital if we can help it or stuff like that. We head stuff off. There's always questions and there's always issues that come up. So just call us, and you'll get an experienced nurse. I'm a phone call away at night. You get an experienced PA. I'm a phone call away, and we'll figure it out. If we need to see you, we'll bring you in. If we need a new order, we'll take care of it. Unlike a lot of doctors' offices, which are basically filters to keep you away.
Yeah, excellent.
And then I see you a couple weeks after the surgery. As long as everything checks out, if you're off your painkillers, we let you drive. You can sleep how you want. Initially, we recommend you sleep on your back if you can.
Okay.
A lot of times people like to sleep upright a little bit, like in a recliner or something like that. We kind of clear you to drive, we kind of clear you to get around, and then usually a couple weeks after that, if insurance doesn't throw roadblocks at us, we'll start you on something called cardiac rehab, which it's a confusing name, but it's just organized exercise 3 times a week, and then you can drive yourself to that. After that goes on for 12 weeks. After that, you're 4 months out. You can do whatever you want. You should be all healed up and like ready to rumble.
Great.
And so that's pretty much it. And then if there's risks with surgery, so we did a calculation for your risk, and this is what we came up with. So chance of dying. This is tailored for you, but this is a general statement for like nationwide. The risk of bypass surgery with a low EF, with stuff like this going on. And so, to me, this actually looks a little higher than I think it is. But it says that you got a 95-96% chance of coming through and basically being fine. I'm guessing it might be 97-98% chance of coming through and being fine. In particular because we've waited, we've let you get stronger and all the rest of it. But it's a couple % mortality risk. That's more risk than you take in everyday life. It's a heck of a lot safer than another heart attack or something like
Oh,
that.
absolutely. Yeah.
And so in terms of being a path to sort of better heart function, which is what we hope for in the long run, or at least not getting worse, but hopefully getting better heart function, and staying out of trouble in terms of heart failure and things like that, surgery is really the best thing if we think you can tolerate it. You know, some people just can't tolerate it because they're too weak, but you're like way above that.
Thank
so,
you.
So, you know, you're kind of an outlier in terms of how fit you are, you know. So you kind of got like one problem, that's your heart. So
Right.
anyway, I think this is the best treatment for you. I wouldn't tell you that if I didn't think so.
Great.
But it is what it is, you
Mhm.
know.
Sure.
It's just in 2025. That's our estimate. You can hang on to that if you want.
Yeah, thank you.
There's other issues that you can have trouble with after surgery. They're all kind of listed there, and but I think it's very reasonable to offer you surgery. I think it gives you the best chance.
Well, my mom went through it. My dad went through it.
Your mom just had stents though.
Yeah, I want it open. I don't want a stent. I don't want to.
She just had stents, but
Yeah.
yeah, and they said she'd only last like 5 years, but she lasted like what, 10, 15?
Yeah.
Good.
She changed her diet and everything.
Oh, good. Okay.
Yeah.
So she did okay.
Um,
But, yeah, so, I guess we need a refill on medications, you know, when they went to fill all these, they didn't do it.
they didn't give you refills, huh?
They didn't do no 90 days, you know, on some of them,
Have you
so.
have you seen your cardiology person, or not yet?
No.
They usually renew stuff like that, but we can potentially renew some of that stuff today.
Well,
Who's his cardiologist? I thought that was you.
Oh no, I'm his plumber.
Oh, you're his plumber?
Let's see. We'll have to see who you're. I would.
They didn't give him anybody. He has to go see his vascular
Okay.
on, let's see, we're gonna go get, some I don't know what kind of x-rays. And then next Tuesday, he goes and sees a vascular.
Good.
He comes
Good.
here.
Perfect.
But
Perfect.
I don't know about a
I'll
card.
make sure you're scheduled to see a heart guy. Down the road, what we'll do before surgery, and this probably ought to be. How do you feel like you're doing with your leg? Do you feel like you're still improving? Do you feel like you've plateaued? Where are you in your recovery?
100%.
Okay, so we'll probably be looking at a month or two down the road. We'll put you on the schedule. We'll let you see the vascular guy. I'm going to try to make sure you see your cardiologist as well. The cardiologist is a person you'll see in the long run. So you got vascular surgery and me. Vascular surgeon will taking care of your leg and may also see you long term to make sure your legs are okay. We do heart surgery, and then once you're recovered from heart surgery, we kind of give you back to your regular doctors. But for a while, we're very possessive.
Right. Yeah, no, I get all that. I like that.
But once you graduate from us, you're a member for life, so you can come back anytime you want. But your cardiologist is a person who manages all your medicines and all your heart stuff in the long run. You know, like forever.
Sure.
So I'm pretty sure you should be set up to see him, but it just may not be obvious to you. So I'll check that. So we'll do meds and cardiology, and then we'll maybe pencil in a day for you.
Perfect.
All right.
Yeah, so what do I do about the meds then?
I'll have Hannah come in and check them.
Yeah, because
Yeah,
I think I'm taking way too many medications.
Well, I don't know, you're taking what you, the only
Oh,
thing
you're
is,
skinny. You're good.
yeah.
If you gain a little weight, it's probably because you're eating and you needed to gain some
I'm
weight.
trying
Yeah.
to gain weight.
Oh yeah,
Good.
he's lost quite a bit of weight.
I've lost
I'm trying
60
to feed
pounds.
him back to
45 anyway.
Yeah. No,
Trying
do
to
that.
get him back.
Yeah, plenty of protein. Keep eating.
Yeah,
You're
I
doing
got a
all-
protein drink.
Good.
Can I have my fritters?
Him and the fritters probably killed him. His apple fritters.
Explain to me exactly what they are.
They're just a donut with apples and
They're apple
cooked in.
fritters.
They're apple
Sweet
fritters.
Jesus, no.
Oh, come on!
In my book, the great Satan is all the carbs.
Yeah.
But but the minor Satan is all is fried stuff, because fried stuff, unless it's your own cooking, you know.
Yeah.
Any commercial fryer the heating.
Yeah, we don't do frying. I do it. If I do it, it's like a little bit of.
But you go to a donut shop or something, or
No.
if you get anything that's fried out in the world, they fry stuff in oils that are old.
Yeah.
Right.
And those oils, they all create trans fats. Trans
Yeah.
fats are like mostly illegal. You know, you can buy a can of cake frosting and eat it and poison yourself with trans fats, but they're almost taken out of every other food because they're so toxic. But anyway, when repeated frying at high temperature creates trans fats in the oil, so that's and then there's a load of carbs in there, you know. So anyway.
Well, that's
Yeah.
what did me in then was my fritters.
Your
Yeah,
fritters
so
did
eat
me.
the apple. Eat the apple.
I
I'm
told
cool with
him.
that, but
You drink it?
And that can play a role. It might not be the cause, but it might
Sure.
stimulate it to be a little bit more active.
Right.
So I mean, there's all sorts of different reasons that they can cause it. Okay, we got the first part done. Now we're going to jump down by your ribs, look up from the bottom of your heart.
Cool.
So I'm going to jump right down here. And there we are. So all four chambers of your heart. Left side, right side.
Now here's the best part of the day. Pain medication. They shoot it directly in my neck. Look at all the tubing. And now I'm feeling no pain at all. Really fun. They said I hallucinated, and the nurse came in and asked me, "Hey doc, what's a downrigger?" Well, I was talking in my sleep on these drugs, and I was talking about fishing. And then I'm getting ready to go home. They gave me a good report, and look at the tube that came out of my neck that they were plugging my medication into. They're removing 8 different items out of my body. IVs everywhere. And it wasn't real painful, but if you don't like needles, you're not going to enjoy this. I had really a good time. In this tube, all I have to do is suck on it, and the ball will move up, watch. And that's to check my intake of my breathing. So up here is where I've been able to, I started down here, and daily I've been improving. So here we go. You're looking at before and after, and a nice shot out my hospital window. Way in the distance, you'll see Mount Rainier on an early morning sunrise, or cloudy as it is today. Thank you for watching, everybody, and I'm back on my feet.